everyone. Before I get started, I'm going to read the disclaimer that you see on your screen. The Pharmacist Virtual Learning Experience is brought to you by Mandell's Clinical Pharmacy and is intended only as an educational program for patients. Any clinic-specific information shared by the nurse is the opinion of the nurses and is not intended to replace the recommendations or requests of your healthcare professionals. All medications will be dispensed by Mandell's Clinical Pharmacy according to the prescription as written by the provider. Good evening, everyone, and thank you for tuning in to the Pharmacist Virtual Learning Experience. This is the first online live pharmacy medication instructional program, and it's brought to you by Mandell's Clinical Pharmacy. This educational program brings you together with outstanding healthcare professionals right in the comfort of your own home. My name is Tony Newman. I'll be your host tonight. I've been a nurse for over 10 years in the New Orleans area. My last 3 years have been in the fertility industry. This pharmacist program takes place every Monday night at 7 p.m. Eastern. And tonight we will be providing a live medication instructional program on 3 fertility products, which tonight will be featuring the Gonol F multi-dose vial, progesterone in oil, and the Hcg trigger shot. This will also include an interactive Q&A session throughout the program. Please join us via Zoom or Facebook Live, and we invite you to be part of the discussion by sharing your questions in either format. Each week, we are joined by a different healthcare professional from across the nation to provide you with real-world experience, just as if you were sitting across from them at your clinic. Tonight, we are joined by Wanda Hofkasang, registered nurse and certified healing touch practitioner. Thank you again for your time and interest this evening, and I want to turn it over to you, Wanda.
Good evening, everybody. Good evening, Tony. Thank you so much for that great introduction. As Tony stated, my name is Wanda Hofkasang, and I am a registered nurse and a certified healing touch practitioner. I presently work in the northern New Jersey area in a fertility clinic. I have been a nurse for over, since 1994, and a good part of that majority has been in the field of reproductive medicine and fertility. My great thing about being here, a part of the clinical pharmacy Mandell's program for the virtual learning experience, is that I think, as Tony would agree, as nurses, we do a lot of teaching. There's a lot of complicated terminology that is a part of fertility, and a part of that as well as your medications, and being able to bring you to a comfort zone with how to inject, how to administer, maybe how to mix those medications. So our plan tonight is that we want to help you become a pro in your medication mixing technique and your injection technique with these medications. And as Tony stated, we have 3 medications that we will be highlighting this evening. And what we will do is show you a video of those medications with the mixing and the administration of those medicines. And then we'll come back live, and I'll be here to answer any questions that you may like to ask of us. Just bear in mind that we are here to answer any general mixing medications or administration questions that you might have about the medicines. Anything that might be specific to you with regards to your dosage, we will always refer you back to your clinic, to your healthcare professional that you're working with at your fertility center, so that for anything specific, you might need to address that with your clinic. But absolutely anything that you would like to ask, and if we are able to answer, we're going to do that this evening. Before we get started, though, with the first video, what I will mention, as Tony also stated, is that this is a live event, but you are also able to go on once you see this presentation tonight, and all the videos are on the mymandellspharmacy.com pharmacist website. So that's really nice to know that that's there for you, so that if you're not taking one of those medications for a little bit, you can always go back on and review it as it gets closer to when you get started. With regards to a little hint I always mention, we collaborate with the pharmacies. We work hand in hand with them to get you the medications that you need for your cycle. And sometimes when you get that box that is sent to you from the pharmacy, it could be a little overwhelming, but we always want to encourage you to open up that box, check the packing sheet, see where everything is. They'll give you the quantities of the different medications that you may be receiving. And it's just real good in the beginning to maybe organize like items together. Some medications might need refrigeration, some might need to be kept at room temperature. But this way here, I think that helps a lot with the planning and making you feel empowered in getting ready with your cycle with the medications. It is always going to be your clinic's responsibility to review specifics. Just know that when it comes to the medicines. But when the pharmacy sends everything to you, they're always going to label things, and it might say to refrigerate, keep at room temp. So this way here, you can organize your box of medications ahead of time. And again, just take that one step closer to before you get started having a sense of empowerment and feeling somewhat organized. I think that helps to alleviate anxieties. So without further ado, what we'll do is Tony's going to bring up our first medication, which is multi-dose Gonol. And so you'll take a look at that video, and then once it's completed, we'll come back and we'll answer any questions that you might have that are that might be you're wondering about after the video. This video is to help you with the multi-dose Gonol with mixing and administration. If you've been prescribed multi-dose Gonol, Gonol is an FSH product, follicle stimulating hormone. So you're taking that product to actually stimulate the ovaries to produce multiple follicles, which in turn produces multiple eggs, preparing you potentially for egg retrieval or for even an intrauterine insemination. So it's just good to know why you're taking something, because I think that's the first big thing to know. So that's the reason, is that it's going to help you produce multiple eggs. Next thing is, how is this medication administered? This medication is a subcutaneous injection. Sometimes nurses will say it's in the fatty tissue, so that's correct too. So to keep it a little less clinical is to say that it's a little subcutaneous injection using a small needle that's going to go in your lower abdomen, lower belly, or your upper top or outer side thigh area. That's strategically where we usually have our patients at our clinic, and I think most patients at the clinics are doing it, that injection in those areas. But again, you would always contact your clinic, your nurse, your team, just for verification, and they will always review with you your dosage and the injection technique and the area to inject. Lastly is this medication, because it is in the subcutaneous or fatty tissue, you could self-inject. So think of insulin when patients before pumps were administering a medication that was needed to be learned by them. Oftentimes diabetics know how to do their own injections. So this is kind of like that. The difference between that is that for diabetes, that's for their lifetime. For your window of fertility, there is a beginning and an end to the injection during the cycle. So I want you to know that. It's just to realize that with each of these medications that we will review or sometimes have you taking, there's always a starting point and there's always an ending point. And there'll just be a brief period of time that you might be taking it to help the action of what that drug's to do. So next step is your supplies that are needed for this medication are going to be your multi-dose kit. You may have a smaller box than this from the pharmacy, but this is a little demonstration kit of mine, but you will have a box similar to that. And in that kit, what you will have is 1 vial of powder. So the medication of multi-dose comes in a vial, but it is in powdered form. And a lot of times the nurses call it a powder, a tablet, a wafer. There's no wrong way to say that. There's just many different ways to say the same thing. So that's what you want, is that 1 vial. Know that that's the medication, is that 1 vial. And it's a multi-dose. We'll talk about that a little more. The other thing that you will need is 1 pre-filled syringe that is provided in your packet. You have a pre-filled syringe that is provided with sterile water, bacteriostatic water, and that's going to help to dissolve the powder that is in that vial. And then you will have 1 Gonol, 1 milliliter, 1 cc, and it does have attached to this one a 27 gauge half-inch needle. And there'll be multiple of these because you're doing that injection for more than 1 day typically. On average, just to put it out there, sometimes anywhere between 7 to 10 days that you might be taking this. Could be a little more than 10 days, but on average, 7 to 10 days of an injection of multi-dose. And so the supplies you need is finishing it off is this injection syringe, which is a Gonol 1 milliliter syringe, but it also has the appropriate size little needle for the type of shot that we are going to do. So as with all the videos or anytime I'm showing mixing of medications, I always remind you that it's not sterile technique, but it's clean technique. So what you want to do is just always good to wash your hands. For sake of the demonstration, I'll take a little bit of hand sanitizer, but mixing medications is not a sterile technique. It's just that it's a clean technique. So it's always good to have clean hands after you've gathered your supplies. Clean those hands, if you will. First step that we're going to take is take that multi-dose vial, and in here for the simulation of this video, there isn't a powdered pellet in here, but you would have a little powdered tablet in here. When you have that tablet, you're going to uncap and hear a little click. And then what you do is, remember I do say in other videos that this is sterile under there, but it's the nurse in me to always wipe the top of that vial with a little alcohol wipe, because any surface that I'm poking with a needle, I always want it to be clean. So that's the reason I'm cleaning the top of the vial. If you ever forget that step, it's okay. Don't panic. It's perfectly fine. It's just, it's something that when you have a multi-dose vial, I want you to get in the habit, because each night you will be utilizing the same vial for your medication or your injection. And so it's very good because it'll be open to the air. That's just good to always clean that top. Okay, clean it with that little alcohol pad, or like I said, you can have your little rubbing alcohol and a cotton ball doused in alcohol just to rub that top of that vial. Then our next step is to take the injection pre-filled sterile water and uncap that needle. And what you're going to do is poke that needle through the center of that vial where there's a rubber stopper, and you're going to gently push the solution of that water, and do it gently because the vial will have little bits of bubbles. It may actually, with that powder in there, it's going to be a little cloudy at first, but what you want to know is it's going to clear up. Sometimes what I tell patients is once you've injected that fluid into that vial, then you can remove the syringe, but then gently roll the vial. You don't have to shake it vigorously. You don't want to create a lot of bubbles. You're just kind of gently rolling because you want to get all that little powder that's in there to dissolve with the water that you're being supplied. Now, the biggest thing that somebody might ask is, how long will this vial last me? That's a difficult question for me to answer for you with showing mixing administration. And the reason that's difficult is that I don't know your dosage. Your physician and your nurse will be developing a plan of your dosage. And so somebody who might be taking a smaller dosage each evening of this product, or each day, I should say, no matter what time of day you're taking it, your clinic will advise you. It may last you more days than someone that is taking a little bit of a higher dosage. So remember that your dosage is tailor-made to you based on your age, your diagnosis, and your history. And your doctor comes up with that plan. But for everybody that uses multi-dose vial, there is typically more than one injection in here. So that's what you just want to know, is once it's empty, you'll know, because you won't be able to draw out any more of that medication. So in the very first night, it's nice and full. And then what you do is you take your needle that says 1 ml syringe, 27G ½ inch, and you open it from its package. It's sterile in there. And with live TV, I've just actually bent the needle a little bit, so I'm going to actually put that down. See, even for me, things like that happen. And that's perfectly okay. I could feel myself bending that needle because it's very fine. So if that ever happens, I'm going to put that in the sharps container, but let me try again. See, it doesn't matter. Even you can have that happen, but even I can have it happen, so don't worry. So I'm taking out a brand new needle and syringe. And what I'm going to do is let you see that this is calibrated in international units of the drug. So meaning that when your nurse gives you your number, that's what she's referring to, is the number of units for that medication that you're going to draw up. So I'm going to use the example of if I'm drawing up 150, which this is the little 150 line. So what I'm doing is I'm drawing down, and the top of the plunger I'm placing on the 150, and I'm going to inject a little air. Because whatever amount of liquid that I'm drawing out, if I'm going to draw out 150 units, I want to equalize a little bit of the pressure that's in the vial. It just makes it a little easier if you draw up that air. It's not incorrect if you don't. It's just a little step that can help make it easier, so never panic if you don't do this, okay? But I just find that it helps it a little bit, make it a little easier to draw up. So you would insert that needle into the vial, right in the center. Oh my goodness. Hold on just a sec. There we go. Okay. Insert that right into the center and then turn it upside down, and then you inject a little bit of air in there. That helps to sort of equalize things a little bit. And it's actually pushing down on the plunger for me right now because of that pressure. So I'll let it do its thing. But then eventually what I'm going to do is I want to gather the amount that I want, which is 150. So once I get it to the 150, I'm going to turn it right side up, and I'm going to remove that needle. A little bit squirted out because I had a little pressure there, but just so that you know, sometimes that will happen. It's not a wrong thing if a little bit squirts out. It just means you're losing a little bit of the drug, but it can happen even to those of us working with the medication, just so that you know. So if that ever happens, just go with it. You still have lots of nice medication in here, okay? Your next step will be that you're going to cap this needle until we're ready to inject. Just gently cap it. And where I'm going to see that I have a few bubbles, air is not an issue going into fatty tissue, but sometimes some of the clinics and nurses may recommend that you give a little tap if you see any little air bubbles, because it just helps to let that air rise to the top, and then it won't be as part of your shot. But don't feel worried if you can't get rid of an air bubble, and there are many times you can't. Just let it be. The important thing to know is that this is not going anywhere near a vein, and that is when air is an issue, when it's near in a vein. This is going into your belly and your upper thigh area, so it's a little fatty tissue shot, so you do not need to worry about that air. Where it is that you're going to administer, I'm going to get my little mannequin here just to show you that you are going to give the injection. It's going to be in either the lower belly, okay, or the upper thigh area and side outer thigh area. No area is better or more efficient or more effective. The little fatty area in here is fine for this medication, and you would move this around for each multi-dose injection you would take. This area here, you move the injection around in the top thigh or even in the side outer thigh. So I always get asked a question of, if I use my belly, do I have to stick with my belly? No, you can use belly and add in the thighs. You could do just thigh and no belly, or you could do a combination. And whichever way you choose to do that is perfectly fine. It's a-okay usually, but your nurse will certainly guide you too as well with where the sites are. But the thing about a shot that's happening for more than one time, it's always making sure that the patient's moving it around from where they gave it previously. If I were to give this person her injection and she were laying down, I would have her lay on her back, and this injection would go in at a 90-degree angle on the belly, would be a 90-degree angle on the top of the thigh, and a 90-degree angle into her side thigh. Because you can also self-inject, though, if she's standing or sitting, this would be the position of her body. So if her position of her body is that she's standing and sitting and self-injecting, the angle of the needle is going to just go straight in. And a big question I always get asked with the shots is, does all the needle go in? And you actually really do need to make sure with this one that all the needle goes in, because you're really only putting in a 1/2-inch needle. And we all have, as you can see, I'll just show you this on this mannequin, we all have this yellow area, which is fatty tissue, and it's usually more than a 1/2 inch. So the idea is that's why we're picking these areas that have good fatty tissue for you to use, but it's very important to get it all the way into that area, okay? So one of the things that you'll want to do is make sure that you clean the area with alcohol. And one of the next steps we do is we uncap the needle. We give a little pinch to the skin. So what I'll show with my arm is that when you're pinching the skin, you just don't want to pinch too hard and squeeze too hard. You could get bruises. And if you get bruising, it occasionally happens to people when they get blood drawn or shots given. It's a-okay. You just want to make sure you don't administer another shot in a bruise. If you get a bruise, let it heal. But the key is sometimes if I see somebody that might have multiple bruises, I might have them show me the technique of their pinching, just to make sure that they're not pinching too tight. So it's really just you're lifting the fatty tissue up off of the muscle, so it's a nice, just gentle lift. I like to kind of think of it as a lift versus a pinch. So we're going to give a little lift to that fatty tissue. We're going to angle the needle straight in, and we do not need to jab, okay? No reason to trauma the skin that way. Just place it gently to the skin, give a little pinch. There's where you will feel your mosquito bite. That's exactly what it feels like when those little needles go in, is a little quick mosquito bite. Now you don't even feel it. Then we press that fluid in there. And with multi-dose, you probably will not even feel that medicine go in. Most patients that I speak to after I've taught them their shots, they'll say, wow, I was really surprised at how little you said I would feel. And I actually really didn't feel anything. And I thought I would feel a lot more. And that makes me happy, so that it reassures them and reinforces what we're teaching. And then when you remove the needle, you can do a little 1, 2, 3 count, move it gently. Set it down, and then you'll put a little pressure there, just to, if there's any fluid that's moving, you want to keep it in the skin for it to absorb. And you also want to, stop any little bleeding. But usually, like a mosquito bite, you might get a little bleeding from these little tiny shots, but not much at all. With that multi-dose, the key thing to know is after you give that injection, what you are going to do is then put your vial in the refrigerator. And then on your next injection, what you can do is take it out. You could leave the vial on the counter for a few minutes, or you could draw up your dose and leave the dosage, just what you need, out on the counter for a few minutes using the syringe, several syringes that you have. Because remember, it's a multi-vial dose, but you have many syringes so that you can do more than one injection. Once this vial is empty, so say you end up having a dose of 150 and you draw up 50 from this one that's just has 50 units. So draw up the 50, cap the needle, open up your new box, mix that vial with the one syringe that has the liquid in it, mix that vial, let it settle, and then take your syringe, clean the top of that vial that already has the 50 in it, and draw up the remainder 100. So you might be using 2 separate vials, one vial that had 50 in it and a brand new one that you were able to draw up the 100 for your total of 150. So it doesn't have to be 2 shots. It can still be just that one injection. But when the vial's empty, it may not be able to give you a full dosage. So that's when you mix a new vial and draw up to the rest of what you need that equals 150. Okay? So I hope that video helps you to understand the multi-dose Gonol product, and best of luck with you in getting started on your injection journey. So welcome back, everybody. Hopefully that was a helpful video in allowing you to see what that multi-dose vial looked like. Not too bad with the mixing, just one little step of mixing and then drawing up until you finish and empty the vial. And the injection technique, as you saw, is a tiny type of injection, which a lot of the medications for fertility are little tiny shots. So you can have many different medications that the injection technique will cover you for. And then some might be intramuscular, and we'll show some of those tonight as well. So Tony, I don't know if we have any questions out there for me.
We do have a few questions coming in. So regarding the Gonol multi-dose vial, can you explain a little bit more about how the overfill can work to my financial advantage?
Good question. So with the overfill, the reason why at a lot of the clinics we tell you to use every last drop is a lot of these medications could be expensive, and even if you are paying out of pocket, sometimes you might be getting a nice discounted price, but we wouldn't need to order you additional medication if you're able to use all of the every last drop that it has. So really for everybody, whether you have insurance coverage or not, you're not using as much of a new vial or maybe a new pen or a new pre-filled syringe. You're not wasting anything unnecessarily or needing to run it through insurance or needing to pay out of pocket. Using the overfill simply allows you to use every drop that you're receiving through that manufacturer's medication. And that's, the overfill, they're putting it in there just in case you have a small accident where something squirts out, which happened even on my video that I showed you, even happens to nurses. But the idea is that they want to guarantee that you're getting the full amount that's stamped on the product. So there's always a little bit of extra in some of these. And so as nurses know this, we always encourage you, use it up so that you don't have to open up a new vial unnecessarily if you don't really need to.
Great answer. And this is a good one that you definitely touched on in the video, but it's always helpful to kind of reiterate. What do I do if I don't have enough left in the vial for my full shot?
Okay. If it is that you have no more medication, the first thing, and it has happened to us with some patients, is definitely call us because we might have to help you with that. Even if it's after hours, that's an important piece, and we don't want you to miss getting your dosage. So if it's that you really don't have any medication left and you only have a smaller dosage, definitely call your nursing team, your clinic's number, an after hours number or during the hour number, so you can speak to somebody about that. But as I showed in the video with the multi-dose, if one vial has some left in it, you draw up to whatever you have, and then you just do a little calculation, as in my example, if your dosage was 150 units each day and you drew up from a vial 50 units and then that vial was empty, you can get rid of that vial that's empty with the 50 units in your syringe and then simply mix a new vial and draw up the remaining 100. So even if a vial's empty, if you still have more vials, you just mix a new vial and add to it, and that's how you obtain the full dosage that you need to take. But if it's that you're running low or you don't have enough, definitely talk to the clinic so at least your team can walk you through the what do I need to do for that for me.
The next question coming in, are there any side effects using Gonol?
Gonol-F is a medication that contains the follicle stimulating hormone. So in the injection site area, you could get a little pinch. As I said, with the needle going in, it might feel a little like a mosquito bite. The medication, on occasion, some people could notice a stinging, quickly fleeting, but with that medication, not often do you notice even a sting. As I mentioned, you could have a little bruise at the area. Look how you're pinching, but some people can get a little bruising. You just want to avoid that. But in terms of what you might feel, most of it's related to the fact that your ovaries are going to enlarge a little bit to accommodate for multiple eggs. So you might feel a little fullness in the pelvis, like a little bloated somewhat. So mild to moderate bloating you could feel. Always good to stay well hydrated to help that. You might notice a mild to moderate crampingness because of those enlarged ovaries and working on multiple follicles. So sometimes the clinics will tell you what preferred products or pain relievers you could take for that if you're feeling any cramps. Sometimes some people with some of the hormonal shifts could feel a little tired, little breast tenderness. So those are the more common symptoms that you might see. We would always tell you to call us if there was anything outside of that, such as any pelvic pain, abdominal pain, any nauseousness, vomiting, diarrhea, anything like that. We would want you to call with anything that's ever extreme, but we will also review with you, as you're hearing me say, that it's not unusual to see a little fullness in the belly, little almost premenstrual fullness feeling, little cramping off and on, maybe a little occasional fatigue or tired and breast tenderness, things like that are more common. But it doesn't even mean that everybody gets all of those symptoms. It just means you might potentially get one or a combination of none or a few of them together.
Yeah, absolutely. I know in our clinic, we get this question a lot, but I don't actually have a lot of patients that complain of too many side effects. So that's always a good thing.
Yeah.
Another good question, I think it's always important for everyone to know, why you're doing this medication. So how do follicles work in a healthy cycle, and what does the FSH, which is the Gonol, actually do to help the fertility cycle?
So we have follicles each month in a natural cycle that are ready and waiting to be stimulated. So when we're naturally ovulating, we have this hormone of FSH circulating, and it will communicate to those ovaries. And you might recruit multiple eggs even in a natural cycle, but there will be one dominant mature egg that we tend to release at the time of ovulation. So with fertility, because we're looking to try to enhance the outcome of pregnancy for our patients that are having difficulty achieving pregnancy, within reason, we're going to look at your age, your diagnosis, and your history and come up with a medication dosage plan that would work for you, meaning how much FSH you might need, your body might need, in order to recruit multiple follicles, which then in turn gives you the opportunity to have multiple eggs. Because even if we do have an egg there that develops, it potentially may not be a mature egg. It may not be an egg that even when it meets with a sperm cell that it may fertilize. There will be a percentage of eggs that although you recruit them and develop them, you know, they may not necessarily do all the steps that they're supposed to prior to creating an embryo or a pregnancy. So that's the reason for looking to try to have multiple eggs, but all of that is within reason. There's, you know, we don't need to hyperstimulate or overstimulate the ovaries. We want to keep it a nice controlled ovarian hyperstimulation, which means we're putting you on medications that hopefully are a good dosage for you, and we're monitoring you to watch your response with that and changing that dosage as needed based on blood work and maybe ultrasound testing that you come in frequently for.
Awesome. Okay. I don't see any more questions on the Gonol right now. So if anybody has anything they want to add, you can always type it in and we'll get to it if we can. I'm going to queue up the next video if you want to introduce the progesterone and let me know when you're ready.
Perfect. So progesterone and oil, that's our next video to show. And this medication is almost actually after something like a Gonol F, because this is almost in that second half of our cycle. It's preparing the uterine lining for implantation. So it's actually at a different point in the cycle, and its purpose is to help the implantation of an embryo, of a fertilized egg, to be successful and create pregnancy. So really the goal of that progesterone is to do just that, is prepare the environment for hopeful pregnancy. Big thing that you'll see that's a little different is the medication is already mixed. So unlike the video you just saw, there is no mixing. You're typically going to draw up the dosage that you need. But the one thing that you'll notice is that you will be taking this medication intramuscularly. It's absorbed by the body in an intramuscular fashion, meaning that it's a little bit different location. Usually you're using the upper outer glute area, the buttock area. So those are the differences, is that it's intramuscular. It's not a little tiny needle that goes in the belly or the upper thigh, usually the glute area, the buttock, and there is no mixing. It's ready to go to inject, but you will be drawing up from a multi-dosed vial. All right, so we can let Tony show us that video, and then we'll come back for any questions that you may have about progesterone and oil. This medication video is to show you how to properly mix and draw up and inject a progesterone injection. With progesterone, why am I taking that? Probably is the biggest thing that we get asked first in the fertility clinics. And with progesterone, what you want to know is that's a key medication to helping the lining of the uterus be well supported and nourished while an embryo is looking to attach an implant for successful implantation. So medications that help that, progesterone being one of them, is used in your fertility cycle, and it's used to help in and around that embryo transfer so that your body has everything it needs in hopeful implantation for successful pregnancy. So that's the first thing you want to know about progesterone. The other thing to know is progesterone is administered into the buttock muscle. The reason sometimes with this medication that we often have patients ask about other areas, though, I was going to say, is that, you know, we use the buttock muscle because it's a big non-weight bearing muscle. I think I do get asked a lot, can I use my quadriceps? Your quadriceps, and I'm standing here marching in place, if I had to lift up legs that were getting progesterone shots, it might be a little difficult to do that. So the idea is that you want it in a nice muscle that's great for absorption, but doesn't have weight bearing on it. And that's what those quadricep muscles have, is that they have to lift the leg. The other thing is the deltoid muscles, where we might get flu shots. Not a great muscle to use for a progesterone shot, simply because it's just too much for these little muscles to handle. And again, these hands and arms have to be raised up, and then you're using that muscle to do that, lifting, grabbing something, and it would just be way too much. So just to confirm that the location is always going to be the gluteal muscle. And the nurses at most of the clinics, even like ours, we definitely, what we do is we try to do our best to help give you a circle on both sides of the buttock, the left and right. Because the thing to know about progesterone is usually you are on it for several days, sometimes it even can be couple weeks. And the reason for that is in early pregnancy, it's what's helping keep that lining well supported again, where that pregnancy is growing until we have a placenta that takes over, which is the mom-baby connection. So that's its key importance, and why you might be on it a little longer than some of the other ones is because that little phase takes a little while for that placenta to fully function. So the progesterone in oil is an injection that it's intramuscular in the buttock. It is used to help support the lining for hopeful pregnancy and nourish and give everything that that embryo could need to have a successful implantation. And it is also something that typically we would recommend that you have somebody administer to you. I'm not going to say I haven't ever helped somebody who had to do their own injection, but when it comes to muscle shots, if you have somebody that can inject and give you the shot, it just takes a little bit of that pressure off. The one thing I will mention is sometimes patients want little hints or help with this shot because they might have heard things about it. First thing I would say, as far as storage goes, it's really important that your vials of progesterone do not get refrigerated. So one of the things I will mention about that is when you get that nice big box from your pharmacy, possibly Mandell's, don't be afraid of it. Okay, guys, you have to open that box because human hands packed it. So you want to take that packing slip out and you want to just look to see quantity of what they've sent. That's really what a packing slip is, just like if we ordered something from Amazon. So what you want to know is it's really a good idea to open up that box, take a peek at it, see that you've got everything that it says has been sent to you, and hold off. You don't have to look through everything right away. But one of the things that I would say, particularly with progesterone, is that typically it's in an oil base. So oftentimes it's very important that it just maintains at a room temperature. So feel free to contact us if you have any other further questions, and contact your pharmacy when you do receive this medication. But definitely get it out of the box and leave it on that counter or leave it in a safe shelf where nobody will get at it. One of the other things I'll just mention is at our clinic, we're okay with letting you use the old tried and true, a little bit of ice to the area. And you're not over icing when you administer for this. You're just going to give a little ice to the area before the injection, and that helps just numb it so that you don't feel any pinch of the needle going in. So ice everybody has available to them at their home. So just know that that's one of the things that I will talk about again, but just to let you know that you can use prior to administering in that glute muscle is to apply a little bit of ice. And we'll also talk about another product that I'll be just showing you here, is just to let you know that there are Cinera patches, which are also helpful sometimes for people that sometimes have difficulty with getting blood drawn, and they've got a lot of anticipation based on that. It is a numbing type of cream patch that you put on to the area. So we'll talk about that later, but I just want to let you know there's some other options that you can talk to your clinic and to your nurse about in case you're having troubles with those injections. So with the progesterone, the next thing that we need to know are the supplies. And so once again, our little list here is for progesterone, we need 1 vial of progesterone in oil, and oftentimes it might come in a box that'll say right on there, progesterone. You will need 1 3cc milliliter syringe, and there may be definitely a needle attached to that. So keep that handy. You'll need that 1 syringe, and that needle that's usually attached is this 122 gauge injection needle. That's usually what is already attached to that. If your syringe comes separately without a needle attached, you would need the 3cc 3 ml syringe, and separately a little package of a 22 gauge 1.5 inch or 1 inch needle. Most often, most of us need a 1.5 inch needle, but there are times that some patients are rather petite and we can order a little bit smaller needle for them that'll still get into their muscle. But most of us technically need that 1.5 inch to get to muscle. And then 1 18 gauge pink needle. It's usually pink in color, a little pink on the label here. It might be hard to see that in color, but just to let you know, it's a pink needle. I want you to know that that is a big needle that looks like a nail. Never, ever, ever would we ever want you to have to do that as an injection needle. So just know if you see that when you open that box from your pharmacy, please do not panic. That pink needle is simply to help draw up the medication. And it makes it a lot easier when something's thicker in that vial, a little bit thicker oil substance, helping you draw it up from that vial is really easier with the pink needle, but then you discard that pink needle. Never, never, never do you need to have an injection with that. You just don't want to put that into the muscle, okay? So always ask if you're ever concerned and you just saw that needle and you forgot, what the heck is that for? And you're panicking that has to be administered into your muscle. It does not. So it goes into the bottle only. So with all of our medications, as I mentioned, it is not a sterile technique to mix or administer medications, but it's always a clean one. So what you want to do is have nice clean hands after you get your supply, so you can clean with soap and water, or you can take a little bit of hand sanitizer and sanitize your hands before you are going to work with that medication and prepare it for injection. So with our bottle of progesterone, there'll be a plastic cap that we snap off. Okay, under there, what you want to know is it usually is sterile after you open it the first time, but this is what we call a multi-dose vial. You are going to use the contents of this vial potentially until it's empty. So because of that, each and every time you want to clean the top with a little alcohol. And if you get these little prep pads, you can use them. The other thing I would say to that is if you don't have prep pads, regular bottle of alcohol, isopropyl alcohol with cotton balls will do. So you don't have to have these little prep pads. If you don't, it's okay. But most of the pharmacies, and I know the pharmacy Mandell's, they do supply this to their customers. So I just want you to know that they will probably be in there for you to utilize. Once you clean the top off, the next step is to take the needle and syringe that may be coming together, or if it's just a syringe, whichever, you need just the syringe to start. So what I always do is, this is in a little sterile package, and when you open it up, you can hold your hand on the needle, pull back the packaging, and just twist off the syringe. And you can leave that needle in there safely. That's our injection needle, so we'll leave it in there until we're ready for it. And then what we're going to do is we're going to take the pink needle, open it up from its package, and we're going to twist that gently on to the syringe. Don't over tighten, because remember, we're going to remove that needle, so we don't want to have it where we can't get it off. So you want to gently tighten it, and that big pink needle is what we're ready to go, and it draw up a dose of medication that we need to administer. Typically what I'll show you is a typical dose is 50 milligrams, which in terms of a liquid amount is a milliliter, 1 milliliter, or 1 cubic centimeter. So a cc and an ml is the same. That's the other thing, that a lot of us nurses have different lingo with that. So some nurses will say take 1 cc, and the patient may have been hearing from another nurse that said 1 ml. So a milliliter is equivalent to a cubic centimeter. So 1 cc is equivalent to 1 ml. Probably a good side note to know that, because we all do have our own little lingo, and I don't want that to throw you off. So I'm going to draw up some air. And the reason I always just do that is because there always can be a little pressure in the vial. So however much liquid you're going to take from that vial, you inject that much air. So you draw down and line up the rim of that plunger to that number 1. If you're doing a dosage of 1 ml, 1 cc, if you're doing anything more than that, your clinic is going to let you know that. So you'll always be following your directions of your clinic. And then what we do is we insert that needle straight into that vial. We push up on the bottle and inject a little bit of that air, and then we draw down and fill up to the 1 ml. With this one, you don't often find that you'll have bubbles, because it's not a water base. Being an oil base, there might be a little less bubbles in there. So sometimes you might hear about air and having to flick out any air. Not typical that you're going to have to do that with this medication, okay? So you can remove the needle. The bottle, you will use it again until this bottle's empty. So remember, multi-dose bottle. Put it away. When you need it for the next injection, when you take it out, you clean the top off. You don't have to cover the top, but you're always going to clean with alcohol before you poke a needle through it, okay? So multi-dose vials are good, because you don't have to use many different items and supplies. You want to then safely cap this needle. The pink needle is going to come off, and then I'm going to discard that in my sharps container. You'll have a red sharps container from your pharmacy typically, to keep safe all of your needle tips and all of your syringes. And then what we're going to do is take the injection needle and now twist that on gently to get ready to administer. So now we have our medication and our injection needle ready to go. A little hint, some people do. I've taught this many years, so it's no right or wrong, just some little tips you could do. If you'd like to, you can roll this syringe in your hand. Because it's an oil base, sometimes people hear that, what can I do to kind of help with that injection when it goes into the muscle? And what can I do to help it absorb or break down into the muscle? So because this is a little bit of a thicker solution, certainly that's the reason why it takes a little bit longer to have it break down. So one of the little tricks could be this rolling, because just the friction and the heat from your hand can do that. I know some clinics might even actually recommend that you could take your tap water, run warm tap water, and the needle's covered, that's sterile, and you can run it over a little bit of warm tap water to just, once again, do what you can to sort of, it's to make it a little less thick when you go to give that injection. Okay, so those are just some little tips that you can try to see if they help you, and I hope that they can, with this injection, help you. The other thing that is a little tip that I know we do at our clinic is, I'll just get my mannequin. This is an injection that's going to go now into the muscle area. Pardon me, she's losing her undies or underwear. This is, the side here is open to show that the red is the muscle. That's why we need a longer needle, because we need to get into that muscle. And all of us have a little pinching of fat. So the yellow is fatty tissue, the red is the muscle, and that's the sciatic nerve. But the nice thing is, when your clinics and the nurses there are marking you, which a lot of times all the clinics do that, they are marking the appropriate area that you're going to need in your gluteus muscle. So what you want to know is, we're marking what's called the upper outer quadrant of the buttocks to administer that shot, so you don't even have to worry about that sciatic nerve, because where we're usually marking you is going to be free and clear of any of that. Keep in mind that when you get this injection, the administration of the needle is something that we'll talk about. You might feel a little pinch if you don't ice the area, or if you don't use one of the Sonera patches, which helps to sort of numb it. If you don't do either of those, then you would feel a pinch with the needle. You might feel a little bit of pressure when the fluid goes in, but it's very fleeting, because you're not putting in a lot of fluid or a lot of medication. Really, with muscle shots, it's the next day. And any of us that have had flu shots or anything, vaccines in our arms at times, you know that your arm feels a little heavy or a little just tired. Or when you work out at the gym and your glutes are a little sore, that's really what you should potentially feel after a muscle shot. There should never be redness, warm to touch, itching, swelling, severe pain. And if there is, always contact your center and speak to your center's, your nurse and or your team, because they would want to know about that. Because we don't want you to feel as though that is a normal symptom that we should feel after we administer these shots. A little soreness, and you should be able to rub at the glute with your hand, but anything more than that, definitely that's something that you can report to your nurse in your clinic. The other little thing that I'll mention about after the injection that's a good idea is gentle massage. Some people even use the foam rollers from their exercising to sort of roll over the area a little bit. If you have a handheld massager that's got some heat, that's great. A little bit of warm, moist heat. These are all things that are just comforting to the muscle, and it just helps. So what you'll find with this injection, when we do have to administer, is the nurses will hopefully have helped you with where to give it and have circled that area. And usually we put circles on both sides, and we do it in Sharpie pen, and you can retrace it because it'll fade a little bit in the shower, but it usually doesn't ever go fully away unless you really are rubbing at it to, with soapy water and such. So it'll fade a little bit, but you can retrace. And you want to move the injection around each evening to a different side. You would want to alternate right, left, left, right, and within that circle, moving the injection around, just so that it gets to all of the muscle and it's not so difficult that it's having a difficult time breaking down. Okay. With this medication, as I mentioned, it is intramuscular in this glute, so it is recommended if somebody could administer the shot to you. If you want to, you could stand for the injection. If you stand for the injection, if somebody was administering into my right glute, what I would do is I would stand and put all my weight on the left side, and I would just lightly touch down my right leg. What I'm trying to accomplish with that if I stand is I want a relaxed muscle. So that's one way you can do it if you'd like to stand. If you don't want to stand, then what you could do if I were administering, and this was a real person here that I would be administrating, her front of her body would be facing you, and the back here where I need to administer is facing me, and I would administer. She's laying down, so her muscle is already relaxed. So key thing with progesterone shot is a nice relaxed muscle, so that just it's nice and easy going in. And again, if you're using a Sanera patch or a little ice, if you do any icing, we always do recommend, though, do not over ice. There's no reason for that. You could just do a couple minutes on your timer on your phone, and that'll numb the surface so that you don't feel the pinch. A little bit of the soreness that you feel, what helps with that really is warm, moist heat, gentle massage, even, like I said, walking around, activating that muscle, but you'll feel it a little bit, but it's not excruciating, and it should never be that you can't sit, walk, sleep, etc. It should never interfere with daily activity. That's important. And if it is, then please notify your clinic's nurse team, okay? So if I'm ready to do my progesterone shot and I have the area and I've iced it already and I'm giving this to someone, I'm going to take my cotton ball with alcohol and I'm going to clean that whole little area. My next step is going to be to uncap my needle. I know this looks a little scary. What I want to say to you is literally the little tip is what's sharp. We don't really, when we're given a shot, we don't sense how deep it is. We sense when it went in. So if that helps you to kind of understand that, I understand completely by looking at the size of the needle, but I want to help to relay that it's the tip when it goes in will feel like a pinch, like when you get your blood drawn, okay? With this one, we do not need to pinch and gather the skin. We actually are going to keep our hands away from that area so we don't get hit, but you could open up, do a little L with your hand and wrap it around. Remember, I would be behind this person if they were standing, and if she's laying down, I would have her on her side and I could be sitting. But in this little video here, I kind of have the angle of this needle going in at roughly a 45-degree angle. The needle going into the body in my hand is in a 45-degree angle. It is not pointed, the needle down to the floor, and it's not parallel to the floor. It's roughly 45-degree. No jabbing. That's not necessary to trauma the skin. Place the needle to the skin and give it a little gentle push. The needle goes all the way in, because that's a question I always get asked, and it needs to go in to get into the muscle. What you then do is take your hand that was wrapped around the hip and hold that needle in place, and you're going to pull back gently on the plunger. When you pull back gently, what you're looking to not see is any blood enter the syringe. And I want to let you know that it's very rare to happen. I think in my 26 nursing year career, I've maybe hit once or twice where I gave a shot and it even hit a vessel or a little vein. It's okay. If it does go in and you notice it and the blood enters here, not a problem. You haven't injected anything yet. However, what you want to do is remove the needle. What we have you do is remove the needle completely, change the needle tip. You can use the medication because it's going into the same person, and go to the other side and reattempt to administer. It'd be highly unlikely to have that happen a second time, okay, just to reassure you of that. But if you pull back and you do see blood, just stop, think of a stop sign, remove the needle completely. You'd put a little cotton ball there, put a little Band-Aid if you need to, and then go to the other side, but change the needle tip, because the needle only goes into the body once and comes out once. It doesn't go back and forth and in several times. So when you pull back, what you're mostly going to see is nothing. There's no change in the color of this liquid, because oftentimes you're in that good spot that's been marked for you. And then you just gently push, and it's going to take a few seconds with the progesterone because it's a little bit thicker, but you push it all the way in. You can do a little 1, 2, 3. And then you remove the needle in the same angle as you inserted it, gently from the skin. You remove it, set it down. Don't panic if you see a little oil coming out or a little blood. Put pressure and hold that cotton ball there for 10 seconds. Here's where some people like to put Band-Aids on, some other people don't. All I will say about Band-Aids is don't leave them on in the morning all day until you do your next shot the next day or anything like that, because you will get rashes from some of those Band-Aids even if you don't have a latex allergy. So put the Band-Aid on if you're getting dressed and you just don't want to soil your clothing, but at some point take it off, kind of like we do with our arm. We don't walk around with that, you know, gauze and Band-Aid there. It's just there to pressure to help that bleeding stop, but this is not even going in a vein. This is going in muscle, so it will stop pretty quickly, okay? And then remember, with progesterone, that you can find out from your clinic what they would like you to do, if they would like to add in a Sanera patch that we'll be talking about at some point on the videos here, or just want you to use a little bit of ice. But post-injection, the key to that is just a little moist heat, a little warmth, a little gentle massage. But the ice really can help with the pinch. And the nurses marking the area, I think, gives you a lot more confidence in knowing where it is that you need to go. Okay? So remember this. This is a shot that when you're taking this for several weeks, you have a nice pregnancy. So the whole goal of your fertility cycle is now manifesting, and when you're doing those injections, a lot of people don't want to get off the shots because they're concerned about doing that for their pregnancy, but you don't have to worry. When you come off those shots, it's a nice reprieve, but you've been doing them and you have a good reason to be doing them. So best of luck with you. I hope these tips help you with the mixing and the administration of progesterone. So as you can see, the progesterone and oil is definitely a different injection than the Gonol multidose, completely different reason within the cycle that you're taking that, but hopefully it gets you to see that there's a variety of ways that medications are presented via mixing versus no mixing, or via a subcutaneous injection versus intramuscular. So if we have any questions about the progesterone and oil, I'm happy to answer those, Tony.
Yes, we do have a few questions. How does the progesterone and oil work, and how is it different from doing like a suppository or a pill?
Well, all of medications, when they're given, whether it be suppository, sometimes oral, or intramuscular progesterone, the ultimate goal of all of them is to support the lining of the uterus and prepare that uterine lining, thickening it for implantation. So really all of the types of different forms of progesterone, which can be vaginal, suppository, or oral, or intramuscular, all of them have a variety of reasons, a variety of ways that they can be presented to you or how you might have to take them, but they all are having the same effect, relatively speaking, on the body. Specifically with the progesterone and oil intramuscular, it's absorbing through an injection, and the oil is being used as the means by which that will absorb into the muscle, and it'll allow for delivery. So really the difference might be in presentation if you're doing suppository, oral progesterone, or intramuscular. But oftentimes, I know for our clinic, we still use an oral we use a intramuscular shot for sure with a lot of our transfer cycles, and even if people are doing a fresh retrieval with transfer, but we don't exclusively use the muscle shot. We certainly use other forms of progesterone as well.
Another question, which I've been getting this a lot in the office lately, so I don't know if it's just the hustle and bustle of the world that we live in. A lot of people are forgetting to do their shot. So what would you recommend a patient do if they forgot to give their PIO shot?
First thing, just whenever you might miss an injection, and that's certainly something we can't know unless you tell us, I would simply say to absolutely first foremost, and obviously, Tony, they're reaching out to you, and we do get it sometimes as well. One little suggestion might be to make sure that you're picking a time then that you are in your home at that hour. Sometimes people forget and they're picking times. If your shot's in the morning, you might already be leaving if you're back to work and you're not working from home. Or if you're doing it in the evening, you might be picking a time that's either too early or you're too late and you're tired. So sometimes, a lot of times, what I suggest is working with setting up an alarm on our phones. We tend to have our phones with us. So even if it's just an alert, if you want to choose a time and then pick the alarm as a way of a reminder, then that's a really good way that you could handle that, is use your phones to your advantage with medications. Because you may not be somebody who's been taking medications on a regular basis, and so it is understandable that you might get busy and miss these dosages. So real important is just to look at your day-to-day and make sure to pick a time when you are home most often, if it's in the morning, and home most often, or if it's in the evening. And then using the alarm on your phone might be a really good way to go about helping remind you.
Another question coming in is, what's the purpose of the oil that the progesterone is injected with?
So progesterone is a compounded medication. So when something's compounded, there may be a type of base, a water base, an oil base for absorption. So really, in a nutshell, the compounding of progesterone that's done at like a clinical pharmacy like Mandell's is the vehicle for helping that medication absorb. So it's really helping the medication absorb in the muscle efficiently and then deliver it to where it needs to go, which in this case is to the uterine lining for preparing for implantation by thickening that lining. So it's used as a means for absorption, really the media or the base of what that medication's compounded in.
Okay, I don't really see any other questions on the oil. If you want to, we can move on to the HCG.
Okay.
Just let me know when you're ready.
Alrighty. So HCG, actually, it's nice that it's following our progesterone injection. It's the same type of injection technique oftentimes, but it can be done both ways. There can be a subcutaneous or an intramuscular, and that's really clinic to clinic. A lot of us use both ways, and we can talk about that after the injection. But what you'll find is that HCG can be administered subcutaneously as a little tiny needle that you could self-inject, or it might be that your clinic is advising you to take it intramuscularly. So it really is covering almost the two medications that we've already reviewed. And it's also a mixing medication. So somewhat like the Gonol multidose, you're going to see that there's some mixing involved in order to prepare that injection for administration. And where this medication falls in with your medications in terms of the cycle is this is a medication that's often in the middle of the cycle, after the Gonol type of medication that you might have been on, but before a progesterone shot, you need to induce an ovulation. And that is really the key factor in the HCG, is it's preparing the body to go into an ovulatory mode, preparing you for either intrauterine insemination or possibly the IVF egg retrieval. So without further ado, we can have Tony load up that video, and then we'll come on back here for some questions that you might have. Hi everyone, the following video is here to show you the mixing and administration instructions for HCG. HCG stands for human chorionic gonadotropin. Sometimes your pharmacy may have sent you a box that has the name on it Pregnil or Novarel, or it might say chorionic gonadotropin. Any one of those three varieties is your HCG injection. And typically this is administered to induce an ovulation. Sometimes it's called the trigger shot by your nurse or by your clinic. When you're taking this, it's to, like I said, initiate an ovulation, and you might be preparing for a procedure to follow, such as an intrauterine insemination or an IVF egg retrieval. Your clinic will review specific mixing instructions for this medication, and they will review your dosage and the method of administration. For the video today, we will demonstrate that this medication can be given either as a subcutaneous injection or it can be given as an intramuscular. If we use intramuscular, we'll demonstrate that we use the buttock muscle for that. And with the subcutaneous, I will show you that it goes in either the lower belly or upper thigh area. Some supplies that you're going to need to get started with this medication, just to give you a little list here, is going to be your box that'll have HCG on there, or Novarel Pregnil. You'll have 1 vial of HCG powder or tablet. So sometimes our lingo is, some nurses will call it a powder or a tablet. Either way, that's the same. You'll have 1 vial of sterile bacteriostatic water. You'll need a 3 cc milliliter syringe, one of those. And you will need 2 22 gauge 1.5 inch needles if you're doing intramuscular injection. If you're doing subcutaneous, you will be using 1 22 gauge 1.5 inch to mix the product, And then to inject it, you will be using a smaller needle that I'll demonstrate, but is a 27 or 30 gauge half-inch needle, which is a tinier, shorter needle to go just into the fatty tissue. So it's always good to get your supplies together first. Then you can always wash your hands before you're getting ready to do this. Administering an injection is not a sterile technique, but it's always good to have clean hands when you're mixing the product. So what we'll first do is from our box, we will remove the 2 vials that we will have. One of those vials will have the powder in it. We'll simulate that with this one. There'll be a little plastic cap on the top that you remove. And the other vial will have sterile water, which you can see sort of here that we have some water in this one. And you take the cap off, the little plastic cap off that as well. Another good idea to do is that you will use a alcohol prep pad if you have it, or a cotton ball with alcohol, and you'll just wipe the tops here with alcohol. It's just a good idea whenever you're poking a needle into a surface, whether it be skin or vial, to just clean the top of that as well with your alcohol. Your syringe that you'll have, the 3 milliliter syringe, may have the 22 1.5 inch needle already attached, or then that needle might come separately. Either way, we would put that needle onto the syringe to get started. So we'll need the 3 ml 3 cc syringe with this 22 gauge 1.5 inch needle for injecting. And what we will first be doing is I'm going to demonstrate a basic mixing method with this, but your clinic will review how much liquid to mix with, and they'll give you specifics. But even seeing my way of mixing is going to give you what you need to know in terms of the mixing. So for the demonstration, what we'll do is we'll mix with 1 ml 1 cc. So what we do is we draw down the plunger and we draw up a little air, and then we uncap the needle, and we first take our vial of sterile water, and we're going to inject a little air into that because there's a little pressure in that vial. So it's nice to kind of equalize that little bit of that pressure in there with entering a little bit of air into it first. If you forget this step, I don't want you to worry, but I just want you to know it's something that we can do, because as I let go of that plunger, it sort of has a little mind of its own and it's moving. But then what happens is eventually that'll all stop, and I will be able to have full control over what I'm drawing up. So in this case, we're going to draw down that plunger rim to the number 1 ml 1 cc. Once we remove that needle, this is extra fluid that you do not need to keep around, and you can put it safely into regular trash because there's been no blood contact with it, so you don't have to put it in your sharps container. Then we're going to take the sterile fluid that we've drawn up, and insert it into the powder tablet, wafer, however you want to refer to that powdered vial, and inject all that fluid in there. At first it'll be cloudy, but then just keep that needle in there, and what you're going to do with that needle while it's in there is just roll around gently. It takes a few minutes to do this step, but just let it take, don't rush it. You just don't want to shake vigorously and create a lot of bubbles with it. If you can, you want to kind of minimize all that bubbling effect. Once you see that it looks pretty clear in there, the next step is to turn the vial, or some people say invert the vial upside down. The next little cue that I always give to everybody is make sure to move that needle down as low as you can without having it fall out, because then what you're going to do is pull back on the plunger and drain every little drop that you've pushed into that vial. So 1 ml went in, 1 ml is what should come out. If you're slightly under it, is that okay? Absolutely. But if you're at a half, go back in, because that means you'll have the other half still left in the vial. So what went into that vial, the 1 ml, as close to that is what you want to remove from that vial, that 1 ml. Then this vial here will once again, this is also going to now be empty because we've drained everything. So this can go into regular trash. You don't have to put it into a biohazard container. And then you cap the needle that you've been working with for mixing. Here's where there'll be 2 differences, and I'll show the intramuscular shot first. After we have our ready mixed vial here, syringe, we're going to remove this 22 gauge 1.5 inch needle and discard, and we could open a new package with a 22 gauge 1.5 inch needle that we'll borrow from that new package. In this case, we would simply not use the syringe that came with it, but take the brand fresh new needle that's nice and sterile, because that's going to mean that's going to be good for your injection. This would be the needle that is used for a buttock muscle injection. If I were doing a subcutaneous injection on the advice of my clinic, which they will let you know, and that would be something going into the belly or the upper thigh, then you would be using a much smaller needle. So the only step that would be different is, I'm just going to take this off for a second and set it down. The only step that would be different is after mixing, I would then attach the very small needle to get ready for preparation of the injection. So we'll put that one back into that packet, and I'll come back to that. But I just wanted you to see that the mixing needle is a longer needle, so it goes in those vials, and then you may be switching to a new needle that's longer for a muscle shot, or a smaller needle that might be for that subcutaneous injection. And I'll just move everything away here. And what we're going to do is, this is an injection if we're showing and demonstrating the muscle shot first. Typically, your nurses in clinic may have drawn some circles on the upper outer quadrant of the buttocks, just to show this side here. It's just to show you that the needle's going into that red area. So we're kind of not doing a subcutaneous, which is the fatty tissue, but we're doing into that muscle, that's that glute muscle. And that's a nice big muscle for that. So a lot of times some people have asked if they can do this in the leg. It's usually preferred to give it here because this is a non-weight bearing muscle. So we sort of would avoid sometimes doing the quadriceps or the deltoid of the arm because that's a small muscle. So often you'll see that your clinic centers may be circling this area for you to administer this trigger shot. If somebody, it's recommended with this one, if somebody can, to be administering this to you. And if you were to choose to stand for the injection, what I would do is, if I was getting the injection in my right glute, I would stand with all my weight on the left side, and I could lean a little bit just so that I'm not wobbling. I could put down my right foot, and that person would have a nice relaxed muscle to administer that injection into my right glute. However, if you would like, you could lay down simply, and if I have this mannequin and she were laying down here and I was administering the injection, then by having her lay on her side and I'm administering the shot right here, the muscle's already relaxed. So either way is fine. There is no right or wrong way of standing or lying down. It's just whatever works for you, and that's what we would always want you to do, is whatever works for you. Some people ask if they can put a little ice to the area. For this injection, a lot of the clinics might say it's okay to put a little ice to numb the surface because you are going a little deeper and that will not interfere with absorption. Or your clinic may be working with you and may have ordered you some Sonera patches, which is a type of numbing patch that you would apply about 20 to 30 minutes before this injection and then remove it to then administer the injection. So if you don't have the patch, it's certainly okay to sometimes, with your clinics, okay, use a little ice just to numb it. If you didn't ice, what I will say is that a lot of times by now you've had several blood draws from your arm. The pinch that you could feel a little bit here is just like a blood draw, even a lot less, because it's not going into a vein, it's just going into your muscle. So I want to give you confidence to know that not to worry about the needle going in, because you've experienced that already with those blood draws. With this, after you do the icing, or if you use a patch, what you're going to do is clean the area with a little alcohol, and then you're not going to pinch the skin. We need to leave it just as is because we want to get that needle right into the muscle. So the angle that you might see me holding this might look like a slight 45-degree angle to you, and your other hand could be here, wherever you position it that's comfortable for the person giving it. But a slight little angle, so I'm not pointing the needle down toward the floor, and I'm not parallel to the floor. It's a nice little angle so that it's going into the muscle. We don't need to jab with this. If you do see that you have a little bubble in here, or a little air bubble, is that something you want to address? You can give a little flick to the syringe. It usually rises that bubble up to the top. But if it's a real tiny one, I don't want you to worry either, because you're not using this into a vein, and that's when we really want to look for air bubbles. For a muscle shot, it's okay if you had a very small bubble there that just can't be moved, and I can even have that happen to me as well. So it's okay to flick at that to release it, but if it doesn't release, it's certainly okay to proceed with your injection. When you're doing this, like I said, it's a nice gentle angle in and a nice insertion. We do not need to jab. So you place the needle to the skin and then give a little gentle push. If you've iced or used Sonera, you might not feel anything at that point. If you didn't ice or Sonera, you might feel just a slight pinch to that skin, sort of like a blood draw when that needle goes in. The next step is to hold this needle in place and pull back lightly, gently, not a lot, not very far, on the plunger. Why we're doing that is we're just checking to see if any blood enters the syringe. If you've had these areas drawn, it's very unlikely that you will enter a little vessel or a little vein. That's the reason for this check. So I want to reassure you that it's not very common to happen, but when you pull back, if you were to see blood enter here, clinics might do different things, so you follow their instruction, but what we would do is either remove the needle completely if we see a little blood enter, put a little Band-Aid here, change the needle and go to the other side to reattempt. Or the other way you could handle it is if you see a little blood, you could pull the needle away from the skin, approximately a ½ inch, check again, and if no further bleeding enters, then you could just inject. Either way is how you'll be instructed with your nurse's help in your clinic, but that's just addressing that if you do see blood, you don't want to insert the medication. You want to hold off and reposition or remove it and go to the other side and reattempt. Either way, eventually you will get to the point where you're not going to see any blood and you probably won't even see it the first time, and then you'll just inject nicely that fluid, let it all go in. Can do a little count of 1, 2, 3. Remove the angle, remove the needle at the same angle as going in, set it down, and then you just put a little cotton ball there. A little bit of blood will come out, a little bit of the fluid, not a lot. It'll only take 10 seconds of holding this here, not even. And then you might have it where it will stop and it'll have a little pinprick there. And you can apply a Band-Aid if you need to. Just remember you have that there. Don't forget, because it's in the back of your body. Just because Band-Aids, even if you don't have an allergy, sometimes can get a little, you might get a little irritated from that. So you just want to be able to know you don't have to leave a Band-Aid on for 24 hours or anything like that. Just for the quick 10 or 15 minutes, and then you can remove it. If this injection is being instructed by your clinic to take it as a subcutaneous injection, then what you want to know with that is the areas typically that they will reference for you is going to be in the lower abdomen and the top upper or side outer thigh area, because it wants to be in any area that where you can pinch a little fat. So using my arm for that, I'm pinching a little bit of fatty tissue off of the muscle. And when you do that pinching, just do a little gentle lift. You don't have to squeeze too hard so that you're not traumatizing your skin by squeezing so hard. You could, with that little shot, subcutaneous injection, you could administer that to yourself, or you could have someone administer that to you. So that's an option. The intramuscular, it's usually recommended if you have someone that can give you that shot, it would be preferred. But with this injection, if you felt comfortable, you could self-administer, or you could have somebody give you the injection. If somebody were to have someone else give them this injection, I usually sometimes recommend that the patient could lay down and you would administer it into her belly this way, because it's a 90-degree angle, or you could administer it into the top thigh this way. Or if we're doing the side thigh, then the 90-degree angle to the side thigh is administering it like this. So it's a 90-degree angle, and if you're getting the shot given to you, then you could lay down. If you are administering the shot to yourself, then you would be in a position of where you could stand or sit, and you would be giving this straight into your belly, straight into the top thigh, and bring it into the side thigh to the side area, like we showed earlier, a little bit of that side thigh. So again, the angle for this one is a straight in, but it's a smaller needle just going ½ an inch into the fatty tissue. So if we demonstrate that one, if somebody were self-injecting, question might get asked, can I put a little ice here? You could, but it sometimes is recommended if you're going to do anything here, maybe to use one of the numbing patches if you have that option, that's ordered for you. But even if you don't have the numbing patch ordered, recommendation is you don't really have to ice these. It's such a tiny needle, you may not even barely feel it. At most, it might feel like a mosquito bite. We all know how that feels. It's a very quick, fleeting pinch. The reason sometimes we recommend refraining from icing with the smaller shots is that you don't want to constrict blood flow. Blood flow needs to be open in the little capillaries to help that medicine be delivered to where it needs to go. So the idea here is just we don't want to interfere with that. The numbing patch won't interfere with that, but the ice, if you leave it on too long, could. So it's best to just know that you really don't need the the ice for this. And oftentimes patients, when I do demonstrate this, they will let me know afterwards that it really wasn't as bad, and I was right, that it felt like a pinch or nothing at all. So I want to reassure you all of the same thing, that it really is something that you won't notice very much when the needle goes in, because it's so fine, that needle. This time we do need to give a little pinch to the fatty tissue. So what you want to know with that is you're giving a gentle little squeeze to the skin, like I said, not a harsh squeeze. You uncap your needle, And then when you have that little pinch of fat, you place the needle right to the skin and just give a gentle little push. Once it's all the way in, you can then push the medication in, nice and gentle. Count 1, 2, 3. Remove the needle, same angle as going in, let it out, and then put a little pressure there. Here, if you'd like to Band-Aid, you usually don't though. If anything, you might see a little clear fluid come out of this opening. So that's the medicine, so we want to make sure we put a little pressure and keep it there, keep it inside the body, but usually not needing to have to do anything with any sort of Band-Aids or anything like that. And then with all of your medications, after you are done with them, when you have this dirty needle and syringe, it goes into that Sharps container. So there is no leftover with trigger Hcg. Everything you typically mix is going to then be utilized for that evening, that day, or that evening, or that morning, whatever time you're taking this. Your clinic will give you specifics with when you're taking it, how much water you're mixing with. Today's demo was to just show you the demo of mixing, and we use 1 ml, 1 cc, but you might use more, you might use less, or you will absolutely be instructed whether you're taking it as a belly shot or thigh shot, little tiny injection, or whether it will be in the muscle. So I do hope this video has helped you. If you've gotten to this point, I know you have good things ahead, and we congratulate you on getting to this point of a trigger shot, and best of luck to you with the rest of your cycle. And we'll see you back here for some future videos. So as you can see with the Hcg trigger shot, that kind of combined the both products that we already saw this evening, the multi-dose Gonol F and also the progesterone and oil, both types of injections. So it was a good overall video to see everything going on there. So Tony, do we have any questions on this one?
Yes, so one of the first questions we have, what is worse, taking the Hcg trigger shot too early or too late? And why is the timing so exact?
So usually with regards to if you're ever taking the shot off the target time that your clinic gave you, that's a real big one to communicate, especially if you're setting up for an egg retrieval. I know in our clinic, at any one given time, we are doing 1 retrieval at a time. So the reason for the different specific times of shots that patients might be given their injection is you might have multiple medications, multiple patients taking an Hcg shot on any given evening, but each of those patients might be given a specific time related to the time of the retrieval. So first off, if you do go off your target time, whether it be earlier or later, it's not that one is better or worse. I think it's most important to contact your clinic and let them know. There might be a need to adjust the time then of the retrieval based on when you took it. So that's what's basically important with that, whether it be that you take it earlier or later. It's just important for someone to know that's not just you keeping that information, so that if we need to adjust, the team will adjust and we will, give you instructions accordingly. So it does sometimes happen, and we've had patients relay to us that information, which is the biggest piece. And then when we need to adjust anything, we do. So I would say that would be good for all clinics to have you communicate that. And then in terms of the 36, 40 hours or the time frame, it's just a matter of the peak action of the medication, of when it peaks post-injection. That's the time frame that we're trying to capture to go in and retrieve the eggs. So the eggs are sort of floating around in the follicular fluid for a little while during that peak. And that's when we go in and drain the fluid to capture the egg during an egg retrieval. So there is a range of time. It's not like it's a specific hour. There's a range of time that those follicles and the eggs are floating in the follicles, and that's when we go in and capture them. So the time of your shot relates to the time of an egg retrieval. It is important. It has been exact, but there's a window of when that retrieval can happen. So if we need to adjust something based on you taking it later or earlier, we can still adjust. So don't panic. Always just, fess up to that so that we can take care of it.
Perfect. I've heard about the potential risks for OHSS, which of course is hyperovarian stimulation syndrome. Tongue twister. Sorry. What is that? Is there anything I could do to prevent it?
So there is a risk. One of the side effects with medications is ovarian hyperstimulation syndrome, OHSS for short. It's thankfully a very small risk. It's in the single digit percentiles of all patients that are ever being simulated. So it's a very small risk. What your doctors try to do in preventing that is, that's why we watch you so closely. So really, we're doing our best by watching you very closely with blood work and ultrasound. And we are also adjusting dosages. But some things that you can know to give us a heads up about is if you're ever experiencing pelvic or abdominal pain, if you feel like you can't take like a nice deep breath in and an exhalation, so any like just pressure, you can breathe, but it just feels like your belly's quite full. Or if you're noticing that your urine output is down a little bit, and you may check yourself on the scale and feel like you've gained a couple pounds within a day. So those are some things that you could look for, that if you notice them, relay them to us. But we are also watching you pretty closely when we are having you on these medications. And often I do get that question, why do I have to come in so frequently? And you do want us to watch you frequently because there could be a time that we might need to reduce the medication dosage. You may not need as much. And so again, with any medication you ever take for anything, you always want to be on the lowest dosage you need for your body. And so how we watch that is through the ultrasounds and the follicles growing. So the OHSS is just, it's an enlargement of those ovaries. And we know that's going to happen to all patients with fertility, but we want to make sure that those ovaries don't get so enlarged and give you some of those symptoms that I kind of mentioned. So you can do a little watching on your own, but we're also watching with you to make sure and seeing how you're feeling and taking a look at the ovaries.
Why are some Hcg shots given intramuscular and some are regular shots, which I assume they would probably mean like the sub-Q shots?
Okay. Usually, as I showed in the video, you can do Hcg either way. Sometimes certain products are manufactured a certain way. Some things come as a pre-filled syringe that are an Hcg variety product that allow for no mixing, and they have to go into the little fatty tissue. So it might be dependent upon the manufacturer. Your clinic might be comfortable with using one way versus another. So sometimes it's clinic driven as to which way they would prefer to have their patients administer the medication. It just might be their experience within their own embryology lab. But we do know that the medication has been studied in a lot of fertility studied in journals, and that's the benefit to all of us that are doing clinics that participate in these studies and have some information that they share about the administration. It could also be body mass index. Certainly your height to weight ratio may determine if maybe the intramuscular shot might be better for you for absorption versus taking it and putting it in the fatty tissue. So sometimes body mass index, height to weight, could be a dominating factor too for us in determining which one you can take. And sometimes it might be dosage. There may be varying dosages, and with the mixing and administration, certainly those dosages can vary based on presentation as well.
I don't see any other questions right now on the HCG. So if there's anything else you want to add before we wrap up, we can go ahead and take
So basically what I want to say is I hope that you found tonight's videos very helpful through the Mandell's Clinical Pharmacy Virtual Learning Experience. Really, like I said, our goal is to have you feel like you're a pro now, maybe in the mixing of those 3 medications that we showcased. Just know that all of these medications are on the Mandell's pharmacy.com website under pharmacist, and you can see the different nurses that are participating in the live events as well and their previous recordings. You can also even just watch individual medications, and so I think all of that's just great for you to know that that is there. And I'm always happy to share what I can share as far as my experience as a nurse and in my clinic, and just over the years of nursing and all the questions that we get asked with fertility patients. One little side note I'll just say, as I opened up with, I am a certified healing touch practitioner, which that just is a type of modality that is working with the energy system. And so what I want you to know, just a quickie note, is if you haven't been somebody who's looked at any breathing meditations and whatnot, and you feel a little overwhelmed by all of this with your cycle and your medications, look up some meditation apps, go on YouTube, go on the different websites, and even if you just plug in 5-minute meditation, I think that's a nice, real good, quick way that you can prepare yourself for getting that mixing and administration aspect of your medications ready. So taking a quick 5 minutes to just pause and breathe and reset, because I know you have a lot going on and there's a lot going on out there. And so those are just some tools to incorporate and enhance your ability to feel more comfortable, more relaxed. So again, look at some meditation and breathing, 5-minute quick meditation just before you're getting ready to mix and prepare an injection. Might be just one little thing you can add that is for you and help empower you with this process. But I do wish you all the very best in your fertility journey and the best of outcomes with a nice, healthy pregnancy.
I definitely agree. I think any kind of stress relief, especially now in today's world, is more than beneficial. So even if you're just taking that 5 minutes just to decompress from a long day before you get started to do your shots, it's always better to be, as less anxious as possible. I do want to thank you, Wanda, for your time tonight. The purpose of our program is so everyone can ask questions in a comfortable space. So thank you, everyone that joined on Facebook and Zoom. And even if you didn't ask something, we do hope you learned something. Don't forget, all of our videos are on the Facebook page, our YouTube page, and then you can look up the mymandellspharmacy.com pharmacist page. We do believe that repetition leads to retention. Again, this program is every Monday night at 7 p.m. Eastern. So we hope to see everyone next week. We'll feature some different medications. So you'll see some of the different types of medications that you might be prescribed. And then please share this program with anyone you think could benefit from it. And just thank you, everyone. Have a good night. We'll see you next week.
Thanks, Tony. Have a good night, everybody. Take care.